In other news, 1 out of 5 people suffer some form of mental illness during their lifetime, with the data indicating that approximately 4.3% of them experience depression. Now, Malaysian Psychiatric Association President Professor Dr. ZURAIDA ZAINAL says in Malaysia, cases of depression have seen a 3-fold increase in the last 20 years. Professor Dr. ZURAIDA said in developing countries such as Malaysia, mild to moderate forms of depression can be easily treated, but it is difficult for people to come forward, and if left untreated, it could have dire consequences such as suicide.
If you want to look at overall why people doesn't come forward to seek treatment, probably the basic things that people don't recognize the symptoms. I suppose for schizophrenia, or people more easily to recognize when someone start talking themselves, yeah, and then we start become aggressive, but they're too late already because they've been hearing voices for probably a year or two. Only when they become aggressive, only the family recognize that person having mental problem, mental health illness. But to understand, to recognize, oh, I'm having depression, anxiety, people don't recognize it. So we have to together collaborate to have awareness campaigns to understand.
She said many who suffer mental illness, including depression and emotional pressure, were not diagnosed properly due to a lack of awareness. Professor Dr. ZURAIDA said this at the 22nd Malaysian Conference of Psychological Medicine, themed the Biopsychosocial and Collaborative Models in Psychiatry in Kuala Lumpur today.